first let me say that the reason for the lockdown in South Africa, as was put forward by government, was to try and flatten the curve. Because as you know, the moment we actually picked up the first case, government was it tried to put together a response to the health challenge initially, but it turned out that the spread was, if not controlled, if not arrested at that time, was going to be quite rapid because of the movement of people. And as people move, as you would have seen, that the first case landed in Johannesburg, moved over to one of the provinces in KwaZulu-Natal, undetected until it was detected in KwaZulu-Natal. And by the time it was detected, the first case had already been in contact with a few other people, and they had come back as a group from Italy, about 10 of them. So all of them had already been in contact with quite a few people in their circles. So the first thing was indeed to make sure that you flatten the curve, you try and arrest the spread of the disease at a point where it was. And I think to a great extent that has been achieved, but it is difficult also to determine that because of the number of tests that we have conducted because of our capacity, but also because after closing off the borders and limiting the movement of people around the country, it was clear that it's only where people met in large numbers that the disease could be able to be transmitted to more than one. So I think to a very great extent, we have achieved that level of trying to flatten the curve, but even though we do not know when it will peak or at what number it will peak. But unintended consequences, economically, we have seen great suffering. A lot of people have actually, not been able to make a living because some of the sectors are affected and impacted upon immediately. A number of jobs, of course, as your second question also seems to suggest, we might be losing a number of jobs, and the economy was already struggling in terms of growth. We will see the contraction of our economy. Sectors that employ a lot of people, like mining, have taken a big knock. They are now in full operation. The first level, coming down to level 4, we started opening the mining sector, and coming to level 3, they are now in full operation. But as you would know, there will be a time lag before that will actually begin to have an impact on the economy. Of course, there would need to be a two-pronged approach. The first is to alleviate the immediate impact, because that has actually had a devastating impact on the families and their households. But also to begin to look at sectors that would actually be quicker to turn around. And as a country, I think we've identified agriculture as one of those that would actually have a quick turnaround in terms of employing more people, getting back into economic activity, whilst addressing one of the most serious challenges the country has of food security, unemployment, and poverty alleviation. So that those sectors are beginning to receive the attention of government, and I would urge government to really pay a lot of attention to such sectors. But again, this has been a test to our health system. As South Africa enters the initial phases of implementing its national health insurance or universal health, it is going to be important that that sector is given attention, because it is a sector also that has a role to play in the economy of the country, as it improves the health of the citizens, but at the same time, it is an economic sector as well. We've seen also how the private sector has been able to work with government in addressing the pandemic, in opening up the facilities in the private sector, but also in finding solutions where the public and the private sector work together. I would also hazard to say that there are also other areas like the provision of the PPEs, the protective equipment. That personal protective equipment, it's the production of sanitizers, face masks, and all of those have actually turned into quite a viable economic activity in the country. Of course, we have seen also some unintended consequences where the prices have escalated in that area, but government has also stepped in there to try and put in measures to control the prices so that, those remain affordable even to the poorest of the poor, but also that the public spaces are now going to be given much attention in terms of making them safer, and the provision of those facilities and equipment is also an economic activity by itself. But as I've indicated also that, some of the requirements, the safety requirements for fighting the disease have become the order of the day, where we will require these face masks, where we will require these sanitizers, where, government also needs to take into account that, as we've always said, that investing in health is well worth the country's resources. So putting resources in health is now going to be one of the priorities that government would have to look into. But at the same time, our health system itself has been tested by the outbreak of the pandemic, and I would imagine that government would have to make sure that we improve the levels of our health facilities, but also primary health care in our, especially the poor areas, making sure that there is enough water, making sure that, our, public places are all hygienically up to standard, and improving the level of making sure that our people receive the primary health care that would actually help them not only withstand the COVID-19, but also other diseases that arise as a result of poor hygiene.